John Rogers. I'm a sports physician. I work with British Triathlon. I've worked with British Athletics over the last 10 years or so as well. Just to get a feel for who's here, can you put your hand up if you're a runner? I'm guessing everybody is. And how many triathletes in the audience? Great. So I'm going to give you a quick overview of the common medical things that we see in endurance athletes. So sort of top 7 things that we see. Get this to work. So this slide's just showing you the difference between adapting normally to training and maladaptation. So one of the common things that we see in endurance athletes are all of us would push ourselves very, very hard to get the best performance and to get the most out of ourselves. And there's a very fine line between getting that peak performance and overdoing it and overcooking it. And when people don't recover properly, they break down with injury and illness. Their immune system gets overloaded. They get tendon problems. They get stress fractures. But a lot of the work that we do with the team of sports scientists and sports medics that we work with is around optimizing recovery, adaptation to training, and using interventions like nutritional interventions, strength and conditioning, optimizing sleep to make sure that people don't get sick and they can consistently train and they're a robust athlete and then they can produce those peak performances. We work in elite sport, we work with a team of people. There's many members of the sports science and medicine team, and part of what we do in the amateur athletes that I work with and that I see day to day in my practice is drawing on the experience and referring to these different experts in different fields, whether it's a biomechanist or a podiatrist, an orthopedic surgeon, getting an opinion from a radiologist, nutritionist for various different causes depending on what somebody's presenting with. But there's a really good network of sports medicine doctors around the UK now that you can tap into for the various problems that endurance athletes get. And in medicine, we take a detailed history, we examine somebody, some of the stuff that Mark was talking about. We do lots of investigations, including scans and x-rays and ultrasound, which we can do in clinic, and we can look at people while they're moving. And then it's not just diagnosing what the problem is, but it's also looking at why this injury has happened at this point in time in this individual to try and prevent that happening again in the future. So here's my top 7 sort of things that we see in endurance athletes. These are really common things that I see in my day-to-day practice from amateur athletes through to elite. So cardiac symptoms in sport and exercise is not that common, but it is very important because the consequences if we get this wrong obviously can be significant in terms of sudden cardiac death. So we do a lot of screening of athletes and the typical symptoms that we screen for are palpitations, chest pain with exercise, dizziness, episodes of collapse. Is there a family history of sudden cardiac death or sudden death below the age of 35? If any of those things ring true with anybody here, you should be getting those things checked out by a doctor. When we do intense exercise, we push ourselves to the limit. There's sort of a perfect storm that can happen. There's an imbalance between your blood becomes more acidotic, there's less oxygen, you're maybe dehydrated, and if you've got a predisposition to having a heart-related problem, that can result in an arrhythmia and irregularity of the heart rhythm that can cause problems. And there's various investigations which we will do to exclude whether or not that's serious or not. So respiratory problems in sport and exercise, we see exercise-induced asthma. Over the last 4 Olympic cycles, all the athletes going to the Olympic Games have been tested for exercise-induced asthma. There's 25% prevalence of exercise-induced asthma in the sporting population. That's not just an endurance sport. And we do specific tests to screen for that. This one here is called an EVH test. I've only got a few minutes left, so I'll run through these. But we see lots of other medical problems in sport and exercise, whether it's from psychological problems, depression, anxiety. We see things like viral illnesses, lots of travel medicine, because a lot of the athletes we work with travel all around the world. So there's issues around vaccination, traveller's diarrhea, underperformance, overtraining syndrome. I've got a particular interest in that because we see loads of that where people just train too hard and don't recover, and there might be external factors like viral illnesses that are predisposed. relative energy deficiency in sport, again, really common in endurance athletes, so people who aren't getting enough calories in to match their calorie expenditure, and really common in triathlon and distance runners. And that causes a whole host of problems, from female athlete triads, so no periods, and osteoporosis and stress fractures, through to other hormonal imbalances like problems with thyroid function. We see biomechanical overload syndromes from the knee to the hip and groin, around the ankle and the shin, as Mark's described, and there's lots of different ways we look at that. Stress fractures, probably one of the most common injuries that I see in athletes, and there's a lot of work that we do to prevent these, and a lot of work we do to manage these in athletes and try and pick them up early. And it's around looking at strength and conditioning, biomechanics, progressive loading over time, not just when we see stress fractures when people suddenly increase their volume or their intensity or their frequency of training. And then the commonest thing we see, this is an ultrasound scan of somebody's Achilles tendon. You can see the bright orange stuff is blood flow, and that's a typical Achilles tendinopathy. We see lots of Achilles and patellar tendon problems in athletes, and big time loss injuries. People can be out for several months due to this, but I'm sure I hope this will resonate in terms of some of these injuries and medical problems with people here. If you have problems like this, there's a network of sports medicine doctors in the UK, both working in the NHS and in private practice, who you can access to treat these conditions. So thanks for listening. I'll hand over to Andy.